Hello, good morning, students. How are you all? Hope you all doing good. Okay, so as a continuation of my teaching, as I'm having a passion towards my teaching, it's never end. Wherever I go or wherever I have to be or whatever I will be doing, but the passion towards the teaching is never ending. It's like a make me or more make me more energetic, and it helped me to a lot to improve myself when I'm doing teaching. So that I decided to start a classes through YouTube videos. So I am going to start with simple topics that helps you to improve your knowledge regarding to that particular condition. It help you add your information regarding to the particular conditions. So that I decided to start on YouTube channel. It's only purely based on the nursing curriculum or nursing topics. So whatever topics, if you want to teach me this topic or whichever subject, research, management, or medical and surgical nursing, nursing foundation, or like that. You want me to teach or different conditions? You can tell me. You can comment me in your comments. I'll take you and then I'll teach you about that particular conditions, and you will be gain more knowledge about regarding to that conditions. Okay. So hope you will be understand this conditions. Hope it will be very useful to you to improve your knowledge. Okay. So, as you take already, if you take nursing students, so they are having a more hardship towards systems. If you take the neurological system is a very difficult to understand for them. And if I can't say, when I was like you, when I was studying my UG by the time, if you ask me to study conditions which comes under the neurological system, it is very difficult to me to understand that. So like as a growing up a nursing students, as a growing up a little buds, you're having that difficulty when you're studying a neurological system. So now if you ask me which one is you most like in all the systems, I like the neurological system. Why means if you understand the concept, if you understand everything in that, that is a very easiest conditions than other. Okay, so it is very interesting one. So hope you will be enjoy it. Hope you will be learn it new things. Okay. So first, I want to teach you about the basic from the basic onwards. So first, if you take as a basic of a neurological system, all neurological system with these conditions only, it is basis. So you ever heard about the uh, intracranial pressure? Intracranial pressure, and then CSF fluid like that. So here it is. I'm going to teach you about the something about the intracranial pressure. This intracranial pressure, which is the basic foundation of all neurological system. Okay. So today my topic is increased intracranial pressure. So when I stated ICP, when I state you about the ICP, by the time you might have a uh, uh, what a little you from the topic itself you might have thought that it is very bored subject, it is very bored content, it's very bored topic like that. But I would say you it is very interesting topic I have ever studied. Okay, so as you know already, our brain, it has a major part, or it is a motherboard of our body. Motherboard means what? If you say in a computer, it is the motherboard is very important. If there is any problem in a motherboard, we cannot able to rectify it, and we cannot able to retrieve it, and we cannot able to do anything in the computer like that. So it is a motherboard of our body, brain. All the activities of a body, all the functions of our body, it is based on the nervous system, is based on the impulses of the neurons. Okay, so if you have any problem in this, it will be directly affect the all the system of our body. So that I am going to teach you about the intracranial pressure, why it is happening, and what are all the symptoms which is occurring in that, and what is the management if it is get increased. So what will be happening to the person or to the patient, and what is the treatment of it, so that we will be going to study with this. Okay, so before that, I'm going to teach you about you. There is a, if you take in our body, you consider this is the cranium wallet. It is the cranium wallet of our person. As you know already, if you cannot able to press your head. Why? Because it is a bony. It is a bony. It is very rigid. It is very rigid. So it is not flexible like your muscles, like your joints. Understand? Like other bone joints. It has a rigid compartment. So if you take, we are having the content which is inside the brain or skull wallet. If there is any problem in this room, so you consider this much amount of a width of the tube, the water is passing. Okay, so if there is any force of a water, so what will be happening? There will be a creation of the pressure in the sides or walls of the tubes. So likewise, if there is any problem in the inside the cranium wallet or inside the skull, it is leads to the increased intracranial pressure. Okay, so you have, as you know already, what are the things is inside the cranial wallet? We are having a brain tissue, and then we are having a blood, and then we are having a CSF fluid. So these three things which is present inside the cranial wallet. If you take the weight of the cranium or weight of the content inside the cranial wallet as 1450 ml. 1450 ml. This is the total volume of the content which is present inside, which means with these three, it is a 1450 ml. So, among this, the major part will be done by a brain tissue. So, the brain tissue which has the 1300 ml. 1300 ml. And then the blood will be parts the major role. That is a 110 ml. That is the 110 ml of a blood, and then 65 ml of a 65 ml of the CSF fluid. 65 ml of the CSF fluid. So you consider that we are having a this much or this much amount of a room or this much amount of a space inside the cranial wallet. If there is any changes among these three, you consider, if you take a brain tissue, so brain tissue, if it is get inflammation or infection, or if it is get atrophy, so what will be happening? So due to the infection, that may lead to the inflammatory process. So due to the inflammatory process, what will be happening normally inside the cell which is get infected? That there is a formation of exudate, there is a formation of a swelling, exudate, and everything. So that what will be happening? The size of the brain tissue will be, size of the cell will be increased. So likewise, due to that, the capacity of the brain tissue also will be get increasing. happening. If you take atrophy means what? Atrophy means shrinken. So the size of the cells which is get decreased. So what will be happening here also? There will be a size of a brain tissue. The cell size will be get decreased. That's the two things will be happening inside. Next one is blood. If you take a blood, so there will be a normal blood flow has to be present in the inside the skull of a person. So here is there is any obstruction in the cranial arteries. So what will be happening? The flow of a blood will be decreased and the pressure of a blood will be increased. Okay, or if there is any increased blood flow towards the brain cells. So that also leads to a tension, create a tension inside the cranium vault. And in some cases, some due to a infection or brainial infection, brain cells infection, or due to any metabolic disorder, or due to any kind of electrical impulses disorder, what will be happening? There will be a chance of increased and decreased production of a CSF fluid. So due to this CSF fluid, so there will be a create a tension inside the cranium vault. So all those things will be corresponding to the increased intracranial pressure. Increased intracranial pressure. Either the brain tissue is increased in a size or a decreased in a size, or a production of CSF which is increased or in a decreased, or it's a production of the flow of a blood which is increased or a decreased. All those things will be lead to a increased intracranial pressure of a person. Okay, you can ask me. So, what will be happening after these? After the pressure increase, it may lead to the so many into end it with to the so many compensatory mechanism. We are having a beautiful mechanism in our body that is a compensatory mechanism. If anything is happen against the rhythm, circadian rhythm of our body, so our body itself it has a own function to recover it. It fights to recover it to the particular problem. So likewise, just undergoing so many compensatory mechanism or auto regulations also cannot able to resolve the problem. So then the conditions will be very worsening to a person. So this is what happening in a increased ICP. So always I'm telling you about the ICP. You might have asked or you might have asked me about what is the normal ICP of a person. What is the normal? So as you know already, in a blood pressures, we are having a normal blood pressure. What's the normal blood pressure? That is 120 by 80 mm of Hg. So likewise, we are having a normal pressure or normal intracranial pressure in a brain. So if there is any problem in these three, it may lead to the increased intracranial pressure. So you might have asked, what is the normal intracranial pressure of a person? Okay, so in some books says, so there will be a there is a the intracranial pressure of a person is it is a 10 to 20 mm of Hg. In some books says it is a 10 to 15 mm of Hg. Okay, so as we take this is the 10 to 20 mm of Hg. This is the normal ICP or intracranial pressure of a person. Is there is any increase or is there is any decrease? It may leads to the herniation of the brain tissue, shift of the brain tissue. So that will be happening in this. So this is the introduction of the increased intracranial pressure. So next we move on to the definition. So first the definition is there is any increased pressure in the intracranial of the brain. So that will lead to the increased intracranial pressure. The normal pressure is 10 to 20 mm of Hg. Okay. Okay. So, students, next we move on to the etiology. So, etiology, or otherwise we call it as a causes. So, we can divide the causes into two. That is a primary cause and then secondary cause. Primary cause and then secondary cause. Primary cause means if there is any problem in the brain itself, so which may leads to the increased intracranial pressure, that we call it as a primary cause. Secondary cause means due to other condition or due to other physiological effect, there will be increased intracranial pressure, that we call it as a secondary cause. Understand? So when you come to the primary cause, it is purely based on the brain tissue or brain problem, or inside the cranial problem, the person may be developed with the increased intracranial pressure. So that we call it as a primary cause. Understand? The first primary cause is primary or intracranial causes. The first is a trauma, and then brain tumors, students, as you know already, we are going to see about the etiology or a causes. So when you come to the etiology and causes, we are having two types, that is a primary cause as well as the secondary cause. The primary cause we call it as a intracranial cause, and then secondary cause we call it as a extracranial cause. So when you come to the primary cause, the primary cause, it may be happens due to the any kind of a trauma. Trauma means there is a due to a road traffic accident, or there will be a injury to a person. So mainly it is corresponding to the head injury, corresponding to the head injury of a person. And then any brain tumors, astrocytoma, so like that, brain tumors which may leads to the increased intracranial pressures, and kind of a stroke. So how, why it is happening? It may be happening due to the hemorrhagic stroke, or it may be happening due to the thrombolytic stroke. And then non-traumatic. Non-traumatic means intracerebral hemorrhage, the hemorrhage which is happening inside the brain. And then infectious disorder like meningitis. So all of this will be lead to the increased intracranial pressure. So as a specialty students, you have to know about. So if you are writing the, or if you are listing the all the causes, you have to explain that cause. So when you come to the trauma, what is happening? Due to a head injury or due to a road traffic accident, there is a hit by in a head, acceleration deceleration effect, or we are having so many types of head injury. In that head injury, what will be happening? There will be a bleeding, there will be a current what there will be injury to the brain cells of a person, there is a leaking of a blood, and then depressed fracture, it may cause the some injury to the tissues, like that we are having. So due to that trauma, there will be changes in the size of the brain tissue, there will be changes in the increased, or there will be changes in the blood content of the brain or a skull. So that may leads to the increased intracranial pressure. So brain tumors what? Tumors meat was there is increased multiplication of the cells before maturation, that we call it as a cancer. Yes, before it which is get matured, or before which is get thing, it will be multiply, increasing in a size. As I told you already, there is no other space to expand inside this cranial vault. So due to tumors, what will be happening? There is a size which is getting increased. The brain tissue doesn't have any other space to expand inside the cranial vault. So that automatically there will be an increase in the intracranial pressure. The next one is stroke. Stroke, why it is happening? It may happening due to the decreased blood supply to the brain tissue, which is get atrophied. One thing, or there may be a clot in the cranial vessels, that may leads to the decreased blood flow to the brain tissue, so that may leads to the stroke. The other part is there is a rupture of the cranial cranial vessel, so that also leads to the stroke of a person. The next one is non-traumatic intracerebral hemorrhage. So now without any injury or without anything, the person may be lead to the intracerebral hemorrhage due to there is a problem in a blood flow. In that may leads to the intracerebral hemorrhage. So this also lead to the increased intracranial pressure. And then infections. If we come to the infection, all the viral, bacterial infection of the brain tissue, which is leads to the increased intracranial pressure. For the example, it is a meningitis. Okay. So this is, we call it as a primary or intracranial causes. The next one is secondary. When you come to the secondary, this causes a extracranial causes. So in this extracranial causes, the first one is hypertension, hyperventilations, metabolic disorder, seizure disorder, hyperpyrexia. The first one is hypertension. So due to hypertension, what will be happening? So as you know, why the hypertension is happening? So if you see, the blood vessel is like this. If there is any problem in the vessels of the blood, it may leads to the decreased or increased supply of a person. Okay. So here, due to that, there is a rise of a pressure in the walls of the blood vessels, that we call it as a hypertension. So here in this hypertension, so there is a pressure which is created in the blood vessel of a person. So when it is reached the brain tissue, so what will be happening? It will be leads to a rupture of a vessel, or it will be leads to a hemorrhagic stroke to a person. So due to that, there will be increased in the intracranial pressure. The next one is hyperventilation. It may be happening hypercapnia, hypoxia state. So decreased oxygen supply to the tissue, and then the level of carbon dioxide level will be increased in the brain tissue. So that also corresponding to the increased intracranial pressure, and kind of a metabolic disorder. If for example, you can take as a diabetic patients. We are having a diabetic neuropathy. So in that may lead to the calcification of the brain cells, so that it may lead to the increased intracranial pressure. And the next one is a seizural disorder. Why the seizural disorder which is happening? Due to there is a sudden electrical conductivity of the brain tissue. So the person maybe leads to the or shows the some seizural activity. So that is happening. The next one is hyperpyrexia. As we know already, if you the person and the child which is below the age of 5 years or 6 years, if the child is having a high degree of body temperature, it is directly attacked with the brain cells of a person. So this is the causes of the increased intracranial pressure. Okay. So now we are going to see about the pathology. As we know already, we are having a three pathology. The first one is cerebral blood flow. If the cerebral blood flow which is get decreased, so what is happening in a intracranium of a person? The first one is there is a decreased cerebral blood flow. So due to that, what is happening? So there will be a increased in the intracranial pressure. So due to increased intracranial pressure, there is a decreased blood flow. The pressure is increased, but the flow is decreased. So the blood flow to the brain tissue which is get decreased. So that what is happening? There is a formation of the ischemia or the stem cell death in the brain or in the brain. So due to that, there will be a raise of the PCO2 level and there will be leads to level which leads to the vasodilation to improve the blood supply. So there will be leads to the increased blood flow which may leads to the increased intracranial pressure. So once the cerebral blood flow which is get decreased, what is happening inside the brain means there will be increasing in the intracranial pressure, there is a decrease in the blood flow to the tissue and that may leads to the ischemia and the cell death, that may leads to the rise in the partial carbon dioxide level and that may leads to the vasodilation and which may leads to the increased cerebral blood flow and that may leads to the increased intracranial pressure. This is the first pathology. Second one is cerebral edema. Cerebral edema. So into the cerebral edema, edema means what? There is a accumulation of a fluid which is present inside or outside the tissue or a cell, that we call it as a edema. So normally, so here what is happening in a brain tissue swelling inside the rigid skull, there is a accumulation of fluids or in the intra, extra or both, intra, extra or both the cellular space. Either it may be present in the inside the cell or it may be outside the cell or the both will be get affected, or accumulation of a fluid in a intracellular fluid or extracellular space, so which may leads to the edema. So that may leads to the increased brain tissue volume or a content. How much the normal volume of a brain tissue? There is a 1300 ml. So if it is increased, what is happening? It is automatically increasing in the intracranial pressure of a person. So that increased intracranial pressure and then it is activation of the auto regulation which is helps to decrease production of the CSF. Understand? So the already we have saw there is a three part which is present in the cranial wall, that is the brain tissue, CSF fluid and then blood. So here what is happening? So due to the edema which is also get increased and again there will be a blood flow or that also increased and again there is the only is remaining part is CSF. So due to the auto regulation it will be leads to, it is helps to producing or a way, what all the way is that to decrease the production of the CSF. Okay student, till now we have seen about the etiological factor of the ICP. Now we are going to see about the pathophysiology. Pathophysiology, as you know, after the effect, what is happening inside the body or what is happening in the particular system, that is state you or that is tells you in a pathophysiology. So here, this is the common pathophysiology of a ICP or intracranial pressure. So first one is there is insult to the brain. You take if there is any injury or if there is any head injury or if any infection, there will be the brain tissue which is get insult. So due to that there is a tissue edema. As we know already, in the inflammatory process of a cell, once it is get injured and after that there is a formation of edema and then it is entering into the inflammatory process of the cells. So we are having a, as you know, we are having a like a wound healing process, we are having a cell replication process and everything. So here due to that insult, the brain tissues which is get edema and that may leads to the increased intracranial pressure. Already we have seen in introduction itself There the cranial wallet, it is rigid, there is no space to expand. So here the tissue which is get edema means there will be bigger in a size. Yes, so when you have a cut in your hand, what will be happening to the next day? The particular part will be get inflamed, or it is like a bulge with the redness around the cut part, that we call it as edema. So due to the size will be get increased. So still due to that, there may be increased intracranial pressure. So once the intracranial pressure which is increased, what will be happening? The other part, there is a problem in the cranial ward. The three things is happening: brain tissue, CSF fluid, and then blood flow. So again, it will be compress the blood flow. It will be compress the blood flow of a person. So due to the compression of a blood flow, which may leads to the decreased oxygen supply, so of the brain cells. As we know, there is a cessation of oxygen in a cell. The cell will be entering into the necrotic or necrosis, so that may lead to the necroformation of the necrotic cells. Understand? So the necrotic cells which is present, and then as around that there is edema which is present. So which may leads to increase, furthermore there will be increase in the ICP with the compression of the brainstem and the respiratory system of a person. So because due to that oxygen supply, it is the body will be fighting against that to improve the oxygen supply to the particular brain tissue in order to prevent the death. So that we call it as a auto regulations or of our body. Understand? A compensatory mechanism of our body. So here, so there will be an accumulation of the carbon dioxide level, that we call it as a hypercapnic state. So due to that increased carbon dioxide level, there will be a decrease in the oxygen of a person. So that what will be happening in order to prevent these two, in order to that, to improve the oxygen supply, our body itself, the brain itself, it is leads to the vasodilation of the cerebral artery or cerebral flow. So due to the vasodilation, there will be increase in the blood volume. Due to that, there will be increasing intracranial pressure. The furthermore increased intracranial pressure, the person may be end up with the death. So this is what happening if the person is affected with the increased intracranial pressure. This is the common one. This is the common one. Once the tissue which is get affected, so due to that it may be leads to the necrosis. It is affecting the respiratory center. It is prone to improve the blood supply, and vasodilation improve the blood supply, that in that also increasing intracranial pressure of a person. Apart from this, we are having a more pathology of increased intracranial pressure. And what all the things is really happening inside the body or inside the brain skull due to the increased intracranial pressure. The first one is there will be a decreased cerebral blood flow, and the second one is cerebral edema. Third one is cerebral response to the increased ICP. Understand? The first one is decreased cerebral blood flow. So if there is a decreased cerebral blood flow, what is happening to the brain? And if the formation of cerebral edema, what is happening inside the brain? And due to the cerebral response towards the ICP, so already we have seen there is auto regulations to improve the blood supply. Okay, so these three concepts or three pathological states we are going to study. Understand? We'll see one by one. So now we are going to see about the pathology. As we know already, we are having a three pathology. The first one is cerebral blood flow. If the cerebral blood flow which is get decreased, so what is happening in a intracranium of a person? The first one is there is a decreased cerebral blood flow. So due to that, what is happening? So there will be a increased in the intracranial pressure. So due to increased intracranial pressure, there is a decreased blood flow. The pressure is increased, but the flow is decreased. So the blood flow to the brain tissue which is get decreased. So that what is happening? There is a formation of the ischemia or the stem cell death in the brain or in the brain. So due to that, there will be a raise of the PCO2 level, and there will be leads to level which leads to the vasodilation to improve the blood supply. So there will be leads to the increased blood flow, which may leads to the increased intracranial pressure. So once the cerebral blood flow which is get decreased, what is happening inside the brain means there will be increasing in the intracranial pressure, there is a decrease in the blood flow to the tissue, and that may leads to the ischemia and the cell death. That may leads to the raise in the partial carbon dioxide level, and that may leads to the vasodilation, and which may leads to the increased cerebral blood flow, and that may leads to the increased intracranial pressure. This is the first pathology. Second one is cerebral edema. Cerebral edema. So into the cerebral edema. Edema means what? There is a accumulation of a fluid which is present inside or outside the tissue or a cell, that we call it as a edema. So normally, so here what is happening in a brain tissue swelling inside the rigid skull, there is a accumulation of fluids or in the intra, extra or both, the cellular space. Either it may be present in the inside the cell, or it may be outside the cell, or the both will be get affected, or accumulation of a fluid in a intracellular fluid or extracellular space, so which may leads to the edema. So that may leads to the increased brain tissue volume or a content. How much the normal volume of a brain tissue? There is a 1300 ml. So if it is increased, what is happening? It is automatically increasing in the intracranial pressure of a person. So that increased intracranial pressure, and then it is activation of the auto-regulation, which is helps to decrease production of the CSF. Understand? So the already we have saw there is a three part which is present in the cranial wall, that is the brain tissue, CSF fluid, and then blood. So here what is happening? So due to the edema, which is also get increased, and again there will be a blood flow, or that also increased, and again there is the only remaining part is CSF. So due to the auto regulation, it will be leads to, it is helps to producing or a way, what all the way is that to decrease the production of the CSF in order to compensate the pressure, So this is happening if in case of the person is in a cerebral edema. Okay girls, already we have seen three pathology which is happening in the increased intracranial pressure. Already we have seen about the two things. The third one is cerebral response to the increased ICP or increased intracranial pressure. So how the cerebrum which get respond towards the ICP. As the ICP raises, so here what will be happening? The compensatory mechanism of the brain which works to improve the blood flow and prevent the tissue damage of a brain cell. So which may leads to it is maintaining a certain pressure to improve the blood flow, and it will be maintaining a certain pressure to decrease the ICP. So when the person's systolic BP is 50 to 150 mm of Hg, and the ICP is below 40 mm of Hg, the brain which is can able to maintain a steady perfusion pressure. Perfusion pressure means what? Perfusion means what? The flow of a blood, we call it as a perfusion. So how it is maintained? It is maintained by a arterial systolic BP which is maintaining in the 50 to 150 mm of Hg, and ICP which is maintaining below 40 mm of Hg. So the pressure, the toe pressure will be in this level, our brain which can able to maintain the steady perfusion pressure, which leads to the certain level of a pressure and the ability of the autoregulations which is ineffective. Maybe there will be a drop of the systolic BP, or there may be a increase in the systolic BP, there may be a drop of the ICP, there may be a increase of the ICP. So which is leads to what is happening, the ability of the auto regulations which has become ineffective, ability of the auto regulations which has become ineffective. So this pressure which is created by the systolic BP and the ICP, which is maintaining the steady perfusion pressure. And here, if the level of a pressure which is increase or a decrease, there is oscillation in this pressure, the ability of the autoregulation which is get ineffective. So which state what? There is no blood flow, there is no maintaining pressure inside the brain. So which will be leads to changes in the mental status and the vital signs of a person. Changes in the mental status and the vital signs of a person. So which leads to a Cushing triad or grave sign. So this is very important Viva question. Explain about the Cushing triad. Why Cushing triad, or tell me the symptoms of grave sign. Why it is happening? Due to the improper perfusion pressure or due to the ineffective autoregulations of a brain cells, which may be exhibit the some mental health symptoms, mental status symptoms, as well as the vital signs of a person. So that we call it as a Cushing triad or a Graves sign. What do you mean that? It means there is a bradycardia. What do you mean bradycardia? Below in a heart rate, bradycardia, and it will be in a hypertension, increase in a BP, and there will be a decrease in the respiratory rate, that we call it as a Cushing triad, or a Graves sign. Understand? So due to that, so here already I told you about the introduction. If there is any increase or a decrease of a pressure or intracranial pressure, which may leads to the herniation, So as we know already, through the osmosis, where the higher concentration to the lower concentration, it will be dropping like that. The pressure which is fluctuating, that may leads to the herniation of the brainstem. So due to there will be a occlusion of the blood flow. So in this occlusion, there will be a cessation. Occlusion means occluded. It is get arrested. Cessation means what? It is stopped. The blood flow will be get stopped, which may leads to the brain death of a person. So this is the three pathological event which is taken place if the person is having the increased intracranial pressure. Okay, students. Now we move on to the clinical signs. So, clinical signs, we can have early signs of ICP. So, once the person has the increased intracranial pressure, so what is the early sign? Early sign is changes in the level of conscious of the conscious state will be get changes, and there will be a changes in the speech, the level of speech, that is a slow in a level, and then there is a delay in a response to the verbal communication, and then headache. So this is the early sign. If the person is telling like this, so you might have seen some person maybe has the increased in the hypertension or increase in the BP of a person. The first and furthermost sign is of a BP is a headache. And then after that also we cannot treat the person. There will be a slurring of a speech will be present, and there will be a mutation, or the person cannot able to articulate the sound while we are doing the verbal communication, and there will be changes in the level of conscious. Now for a high in a blood pressure itself, the person is showing these kind of symptoms. So it is happening in a all the pressure increase. It is in a ICP also, the person will be changes in the level of conscious, and then there is a slow in a speech and delay in response to the verbal communication, and then headache. When you come to the due to ICP, what are all the changes which is happening inside? The first one is eyes. If you take eyes, there is a papilledema will be present, and then impaired eye movement. Impaired eye movement means there is the there is no movements of the eye. The eye will be fixed in a one place, that we call it as a impaired eye movement. And pupillary changes. Pupillary changes means there is no articulation or rotation of a pupil to grasp the things. It is a fixed pupillary, or it is a deviated pupillary, like that it will be happening. And the next is a changes in the position of a person. It may be leads to a decerebrate and decorticate posture. Already we have seen there is a complete flexion or complete extension of the extremities which is taken place in a decerebrate as well as the decorticate in posture. So it is happening due to the increased intracranial pressure. The next is the apostymos posture. So this will be which is like a bow, like a appearance which is taken place if the person has a increased ICP. So we are ongoing classes, we will be seeing these kind of symptoms in a detail in a future classes. Okay, the next one is flaccid. Flaccid means what? There is a decrease in the control or a contraction of a muscle, that we call it as a flaccid. So there will be a flaccid will be present. And then there is a motor function which is get decreased, changes in the motor ability. So and then the person maybe shows the symptoms of the cerebral activity, and then there will be a impaired sensory and then motor function, and then changes in the vital signs that already we have seen in our pathophysiology, that will be exhibiting a sign of a Cushing triad or Graves sign that is happening. And then vomiting. If you take a vomiting, it will be a projectile vomiting. It will be a projectile vomiting. When you take a headache, the headache, if it is increasing in the morning, or if the person do any bending, or and by the time it will be get aggravated. It will be get activated. The vomiting will be a projectile vomiting, and changes in speech or stuporous means what? Mute or a coma stage, like that. And then restlessness, confusion, and increased drowsiness will be present. So these the symptoms or signs and symptoms we can see if the person is affected with the increased intracranial pressure. Next we move on to the diagnostic studies. As a nursing students, we have to know about we have to collect a history from a patient and then do a physical examination. In this physical examination, we have to do a neurological assessment of a person in order to check the signs and symptoms. And then we have to go with the CSF fluid monitoring, and then we have to go with the CT, MRI, brain, MRI brain and CT brain, and then we have to check the patient's flow of the cerebral blood flow, or a pressure of the cerebral blood flow. So in order to check the pressure of the cerebral blood flow, we have to do one invasive procedure. We have to do an invasive procedure that we call it as a ventriculostomy. So ventriculostomy means we have to implant a catheter, operating catheter inside the ventricles of the brain, and that's the way we are maintaining the we are checking the production of the CSF fluid, and also we are doing the ICP monitoring, pressure monitoring. So here when you come to the intracranial pressure, the lumbar puncture is a contraindicator. Lumbar puncture is a contraindicator. Apart from that, we are doing the history collection, physical examination, CT brain, MRI brain, ICP monitoring, and then invasive method of monitoring of ICP and CSF productions, that will be done by a ventriculostomy of a person, or ventricular shunt we are doing. Okay. So next we move on to the management. So when you come to the management, we are having a three type of management: medical management, surgical management, and nursing management. Here in this medical management, first we have to go with the first we have to do a diuretics, infusion, sedation, hyperventilation, administration of corticosteroids, and analgesics. The first for the most management is that is an diuretic infusion. So in order to that, so what we are using means to improve the elimination or to improve the output. That's the way we are maintaining the pressure of a person or of the brain. So for that we are doing the mannitol infusion. We are doing the mannitol infusion. So mannitol infusion we are doing in order to reduce the ICP of a person. In order to reduce the ICP of a person, we have to administer the mannitol. So here 20% of a mannitol in 100 ml of fluid. So in according to this rate, we have to do a mannitol infusion of a person, and then we have to go with the sedation. So in that sedations we have to administer the propofol and then barbiturates, and then we have to do a hyperventilation therapy. Already we have seen here there is a PaCO2 level will be increase and there will be a decrease in the PaO2 level. So if we are doing the hyperventilation therapy, so by the way there will be a decreasing in the PaCO2 level and then increasing in the PaO2 level. And then we have to administer the corticosteroids in order to prevent the inflammatory process or response, and then analgesics to maintain the pain management of a person. So this is the medical management. The main thing is mannitol infusion in order to relieve the ICP of a person. And then surgical management is craniotomy surgery. Here we are doing the decompressive craniotomy surgery. So this topic is very vast. We will be seeing in a next class about the types of craniotomy and everything, approaches of craniotomy, that will be seeing in a next class. Okay. And the next is a nursing management. In a nursing management, we have to do a history collection, physical examination, and then we have to do a neurological assessment of a person in order to find out all the signs and symptoms of a person. And then we have to do a head elevation, and then ask the person to limit the intake of the salt content food and restrict the fluid intake. So this is the management of a person, those who are within a increased intracranial pressure. Hope you understand. I hope this class will be help you to know about the what is ICP, what is the normal pressure of intracranium, and what are all the causes we are having. Mainly we are having two causes, that is intracranial causes and then extracranial causes. So what is the pathophysiology and what is the pathology inside it, and what do you mean by Cushing triad, and what are all the clinical symptoms, and what is the management diagnostic studies. When you come to the management, we are having a three management, that is medical management, surgical management, and nursing management. Okay, so all of these you have some idea about the ICP. So in upcoming classes we will be study about the conditions, important conditions which is comes under the neurological system. Hope that this class will be very useful to you. Thank you girls. Have a good day. Have a nice day. Do a great job. Improve our knowledge and gain a knowledge as much as possible. Be happy always. Bye bye. See you in the next class.